Hi to everybody. Sorry. Okay. A great hello from Italy. I'm a plastic surgeon from Italy, and I want to share my knowledge about the InMode platform. I'm using since 12 years now this device, and I'm really happy to share from you this information. So now I want to start to show you that there is just a moment. I want to cancel my what is it? Okay, sorry, there's a problem. So now what we can see, sorry, because I want to change my okay, this is perfect. Now as you can see, the facial skin tightening has long been a elusive goal in aesthetic surgery. So many times we have a treatment gap includes cases where not severe enough for excision surgery, but not mild enough for most traditional non-invasive aesthetic modalities. So what I can do is showing the aging of a face that is evident, particularly in the lower third. Can you recognize the first one on the left? So, okay, is Angela, she's Angela Merkel, and this is Brigitte Bardot. So what I want to show you is that on the lower third, and especially on the neck, on the border, on the jawline, there is a great aging of this one. Even my dog has a great aging.
Sorry, Dr. Rovatti, we have lost the screen, your screen. I cannot see your screen at the moment.
Oh, sorry, what is it? Sorry, I don't understand. Okay, maybe this one.
Yeah, now we can see your screen.
Okay, so I was talking about the aging of a face. Did you see Angela Merkel and Brigitte Bardot? They have a lot of aging in the lower third, and even my dog in the lower third. So now the past was melting fat and not tightening. As you can see, I'm treating, yes, 15 years ago, and we're treating the fat. We have melting, we have oil, but not tightening septa. This is what we want now. So now the goal is tissue retraction. So bipolar RF is one of the most effective devices for tightening. You can see on the left side, I'm treating with a body cannula, a big thickness fat, and I have great contraction. So radiofrequency is an electromagnetic field that propagates through space and delivers heat energy to tissue non-specifically. So we can make some comparison like bipolar that is faster, that is more homogeneous, that have more tightening and has a feedback temperature. Anyway, we have on a monopolar fiber or laser fiber, we have slower. They are less homogeneous, and we can distract the septa, and we cannot monitor the temperature. So we can see now RFAL and monopolar RF. So we have 5 times more to reach the same temperature. So bipolar is much faster and is much more homogeneous, because you can see with the infrared camera, we have a localized heating with the fiber and homogeneous with the device, with bipolar device. So we have 3 different handpieces to treat 2 different levels in the face. You can see the first one on the left is the Accutite. It's very thin. It's very, it's like a cannula for filler. We have Face Tight on the right, and we have Morpheus that is fractional with needle for more superficial treatments. This is treating, we can treat hypodermis and dermis with Morpheus, and Accutite heat hypodermis and subcutaneous, but very thin fat thickness, and Face Tight heating on subcutaneous tissue. So we can go from 1 millimeters to 1 to 4, from 5 to 10 with Accutite, and from 10 to 20 millimeters. So 2 centimeters with a Face Tight we can go. So now we can present
at last. Welcome to you. As you no doubt have guessed, I am Morpheus.
Okay, this is Morpheus, and this is Morpheus 8. This is the difference. So this is the fractional transdermal device that can go from 0.5 to 7 millimeters for the body. So in the face, we have 12 needles based on the upper lids and obviously on the lower lids. And so we can treat all the sagging skin in periorbital area. So this is 24, and we can treat even most the area, bigger area. And you can see that we have also 40 needles up to 7 millimeters, and we can use on the body, or I will show you up in some points of the face, in some areas. So we can start from 1-2 millimeters on the face, on the neck, in the area, and we can treat dermis, hypodermis, and all the skin will be better. You can see on the right side the local anesthesia that I'm doing, and we can treat all the face. The neck is one of the most treated area, and it's very easy to do it because we have a simple display. And now I can show you the timeline that we can have before the treatment. Immediately after, there is a little bruising and swelling and redness. And after 3 months, the skin is better. But after 6 months, is getting more, is better. And this is a treatment supporting two layers, like Acutite and Morpheus, because Morpheus is going to treat all the skin and dermis, but we can treat the jawline with the Acutite. But after we will see the Acutite. So now we can treat many areas with the 2 layers treatment, like neck and jawline, like lower lids, like malar bags, labia minor and major, medial upper arm, knees, abdomen, around belly. So these are all the area of the body. But now we are speaking about face, and the 2-layer treatment we can do nasolabial fold, the lower lids, and malar bags. So what about the lower lids indication? I think that a pinch test and distraction test must be negative, and the patients could have a big skin laxity and poor fat. So we can use only Morpheus just to treat the skin and a little fat. And this is. Now we can have also moderate skin laxity and a medium quantity of fat, so we can use Morpheus and Acutite, and this is a typical case. If we have a big skin laxity, a great fat, and a pinch text negative, but this is like these patients, no treatment, lower BLEF is better. So this is what we can do with a fractional treatment coagulation. So we have the possibility to treat 3 millimeters, 2 millimeters, 1 millimeters, and so we can decide. So it depends from the patient's type. And now I'm treating 2 layers and 3 millimeters and 2 millimeters, and I'm not giving too much energy, too much heating, 35 watts, but we can go until 60 watts, but I think is too much for this area. This is a demonstration test. We used Morpheus only on one side, and you can see that one treatment with 2 layers and 2 passages with overlapping, you can see the left eye, the left lower lid is going to be better. This is a great contraction of the skin and on the fat. And this is just to demonstrate the difference that you can have with only one treatment. So in this picture, you can see that we have treated Morpheus on the lower lid, and we did the upper BLEF on the upper BLEF. And you can see that after 1 month, only 1 month, we have a great results on the lower lid. You can see that is 1 month because you see still swelling the upper breath, but you see there is a little fat and the skin is sagging, but after only 1 treatment is better. But usually we have 2 or 3 treatments with 2 months apart. So if we have also some fat, we can also treat some lower lid, like lower elastosis and iritis, small lower lid fat pad, and the positivity of of snapback test and distraction test. I want to tell you that there are many approaches to lower eyelid, and this is the anatomy, and you know that we must treat this area with our device, with our Accutite. So we can use it below the orbital rim, and just to pay attention to the zygomatic facial nerve that is on the lateral side, but we can treat all this area. The SUF is our target, and we can treat this area, treating in this way. This is the Accutite. I'm introducing from a lateral point, and I'm treating this area, giving just a little heating below the orbicularis muscles. My plane is the SUF and is below the orbicularis muscle. So the energy is only 0.2, 0.3, 0.4, not more than this one. You can see now, I don't know if you can see because it's not a good video, but I'm treating just during a lower breath, and I'm contracting the orbicularis muscles. As you can see, there is no great contraction of the muscles, so we have a contraction very easy and very easy to perform and easy to have a result. So these are some kinds of results, but you can see that I had in the first treatment, like this one, a little scare show on the lateral side, but the patient doesn't complain anything, but was good for her, but not good for me. So these two, so this is to pay attention. The first trick is don't go above the orbital rim. So stay below the orbital rim and treat just a little amount of energy. So we have a contraction that is enough. So after this kind of mistakes, but no problem with the patients, after I did lower treatment, and in this case I treated also with Morpheus on the upper breath, on the upper lid. So combination of these two treatments can do a good results. This is a combo treatment, Morpheus and Accutite, just to reduce this kind of fat. But you have also a great reduction of Morpheus. If you are 3 millimeters, you can find fat and you can have a coagulation of fat. So this is a good, very good results because I've treated with the Accutite the fat and with Morpheus the skin. So we have a good results. What I can tell you that after 4 years, we had acceptable results for the most of the patients, and we have only few sclera show, but just in the starting of my treatment, and I had some insufficient results that I treated again. But what we can do more with festoons. Festoon is much more complication of this of the malar bag, and we have in the malar festoons, you know, we have a zygomatic cutaneous ligament on below and the orbital septum up. So we have this kind of area that contains fat or muscles, sometimes in the festoons, and sometimes may be congenital. We don't know exactly, but what happened? Sorry, I can go away. Okay. festoon represent the progression of what is described, and it's really, really difficult to understand how to treat it. So what I want to tell you is that SUF is our heating target, and we must go deep with the acutite, and we must treat in two planes, in two layers. First is deep, and deep SUF, we are stamping. So I'm stopping and I'm contracting all the area in the SUF with a vertical scepter. Look, I'm stopping and I'm treating some areas. After I can do also some Morpheus treatments. As you can see, I did here a lower bleph, and after I treated the malar bag. This is a malar bag treated with Morpheus only. Sorry, with Morpheus and acutite, and these two. These are festoons, always with treatment with Morpheus and acutite. And even in this case, we have a good reduction after two treatments, usually apart one from the other in 2 months. This is a case that I want to show you. This is a great malar festoons and was very difficult. And when I treated it, I had some depression, and maybe the acutite too much, or the skin was not so great thickness. I don't know, but I had this one, and I treated with Morpheus and acutite, maybe too much. And after I did on supraperiorbital some filler to fill again the area, and I treated again with Morpheus to treat the skin. And after, the final result was really good. So you can see that festoons, it's a stable results after 1 year, and I feel it just in the area where I had too much contraction, because the second tip is be careful with heating. Now I'm doing, but I just want to share you this three starting cases. So I'm treating with a 40 pins, and I'm going to 5 millimeters. And so I don't do acutite. What is the problem doing acutite? Is that my patients have a long swelling. Usually they have swelling for 1 month, 20 days, and this is not good. So now I'm treating just only with Morpheus, and I'm hoping the results will be good. Until now, I have good results, and they are still stable, but I are only 2 months that I've started treating. What about the upper lids? Well, I can tell you that I use Morpheus only where I see just a little laxity of skin, poor fat pads, and I use only Morpheus, and can treat with some acutite, but I can tell you I have no experience, because I don't want to do the acutite in the upper lids. If I have a great skin laxity and great fat pads, I prefer to do the upper blepharoplasty. I treat with Morpheus, just this patient has a previous blepharoplasty, but still a little skin sagging, so we can treat, and we can do on the upper lid very easy with local anesthesia. And you see, this is a fixed mode. Fixed mode is just when the needles are in and deliver energy, deliver heating. If it's a cycle mode, they go in, deliver energy, and go out. So it's more light. So this is a treatment that I didn't have a great results. This is an insufficient results. So I did only 1 Morpheus, only 1 layer, and maybe it's not great, great results. But this one was better, because 2 layers I did after 6 months. I had results with Morpheus only. What about complication? The complication was this one. For example, I had in these patients a burn, a superficial burn, unfortunately, because she moved, just because she was distracted. I was treating, but she didn't feel pain. Maybe I didn't prepare to say to stack on her. and she moves. So I had a superficial burn. After 1 month, it was better. And 3 months after IPL, I had hyperpigmentation and was better. Below, you can see a point where I enter with Yakutite, and I treated also with Morpheus. You can see the red pins, and maybe I deliver too much energy. So the third advice is be careful with heating. Don't do too much heat in the same session. Swelling, crust, and this is the results of the patient before, after it has no hyperpigmentation result. What about brow lift? We can use also on the brow, but first we must have an assessment of supraorbital laxity, and we must understand that brows asymmetry are extremely common, but we must know exactly the forehead anatomy. So we have supraorbital and supratrochlear nerve that they are going more superficial in this area. So what we can do is to have a little area where we can have a safe treatment. And now I will show you where. So this is the supraperiosteal fat that is below the frontalis muscle. And this is our target of contraction. We must go over the periosteum, and we have this safe treatment area. This little corridor is 1 centimeter wide, and we have in the hairline 1 entry point, and we have in a no-fly zone just below 1 centimeter, above 1 centimeter the brow. And so if we respect this area, we don't have any problem about the nerve or neuropraxia. Zygomatic temporal is out, is lateral, and the other supratrochlear and supraorbital are superficial, but we cannot find in this area. Local anesthesia, we can do just 2, 3, 4 maximum milliliters of lidocaine, and saline solution is diluted. After I will show you the dilution. And when I'm treating this area, I need a very little amount of anesthesia if I don't want to have swelling in my upper lid. So these are the local, and this is the treatment. I go below the muscles. The entry point is in the hairline, and I'm treating, going back, going backward.
Not below the cannula. So,
and this is the treatment. Needs only 5 minutes. You can treat this area until we reach the end point, that is to reach the temperature. That in this case we put as cutoff 65, 68. This is the area where we can slide over the periosteum, and this is, you can see the little thickness of fat that we have below the orbicularis muscle. Now I'm heating the frontalis muscle, sorry. Now I'm hitting the frontalis muscles, and you can see a little contraction of the muscle. Okay, this is a cadaver, but what we can say is that we can treat the muscles. We can have a contraction. The infrared temperature, skin temperature, you can see the line on the forehead that we did after the treatment. And this is our endpoint. We have an immediate contraction, and we can do just during upper breath or just only this treatment. We have an immediate contraction, and we lift just the lateral third of the brow. This is another one. This is my assistant, that she had only 1 brow lower, and we treated only 1. Now the results, I can tell you, after 2 years, 1 year and a half, they are fading away, and we will do a new treatment, because usually the treatment is 1 year, maximum 2 years, is going to be stable, and after it fade away. So this is another one. And this is another one. You can see the skin on the upper lid is more contracted. So this is a good result just with the brow lift. So with the brow lift and the Accutite, we can lift also some skin of the upper lid. This again is a new one, sorry. Okay, this is a face tight and brow lift. You can see our total of kilojoules, and these are the lift of the lower lid. Sorry, we did lower lid here, fat grafting, and upper lid it was with Accutite brow lift. This is an upper breath, more brow lift. And this is what we can have, an hypercontraction after the treatment, but is a temporary side effect. We can, don't worry, because after 24 hours, 48 hours, it fade away. So some consideration about this one is all the patient treated has numbness, tingling in the head, but non-dysesthesia, non-neuropraxia. I had some insufficient results, and I'm waiting to treat them after not less than 6 months, 9 months again. What about the lower third? Lower third and neck, it's a good treatment, and now I can tell you we need a correct assessment, marking the tissue and treating with fractional or with Accutite or face tight. This is no-fly area, no-fly zone. And it's up to you to choose the correct thermal device. I don't like to have these big guns to go in the neck like this one, and this is the plasma. But I prefer on the right, the small one, the small cannula to go in and to deliver energy that could be enough for our neck, for our subcutaneous tissue. This is what we have. We need only anesthesia, like saline solution, epinephrine, and lidocaine. The device, nothing else. Few drapes, sterile drapes, and nothing else. Well, there are many kind of correction of depth, of cervical mental angle, of mandibular border definition, of mandibular angle definition. So we can speak about many things and many treatments in our neck. But what I can tell you is I want to choose the easiest way to treat my neck. And I don't want to inject desoxycholic acid because I have many problems. I don't want to do big surgery because the people don't want now anymore big surgery. So what we need is anesthesia, local anesthesia, and this is an office-based treatment. And after I can treat in this way with a small device, and I'm treating subcutaneous tissue, only subcutaneous. I'm going very superficial. I'm treating my septa. Fibrosepta network are my goal, are my target. So this is after the treatment. On the left side, you can see that there is a great contraction up to 40%. This is the treated side. You can see the difference. So we must have a clinical view of what we are doing. So in the neck, we have a safe area that is the pre-platysmal fat, and this is above the platysmal muscles. So the anatomy is just only one point, that is fascial artery, is a great dangerous point, and this is the fascial artery. But we have also the marginal mandibular nerve. That is a great problem when we do a facelift, when we do every procedure like a liposuction. So we must be careful about this area. where the marginal mandibular nerve cross the facial artery is just above the masseteric tuberosity. And this is the area where we must pay attention. And so is where we don't want in 3 centimeters from masseteric tuberosity have any damage. So there are many papers about bony anatomic landmarks to avoid injury. And I want to show you lifting the masseter muscles and the platysmal muscle is below. You can see now the white nerve, yes, is there. And you can see that it's going more superficial, but we are always below our device, our handpieces. The great luck is that we have our heating just in the 2 electrodes. So I have my device that has all the heating above the cannula and not below. So that's why I'm treating only the subcutaneous tissue, and I will be sure that don't have any problem. This is our intersection among the facial artery and the marginal nerve. This is what I can show you. And this is the area where we can divide in this picture. Second described an area close to this point as a facial danger zone, drawing a point on the middle of the mandibular body 2 centimeters posterior to the oral commissure and allowing for a radius of 2 centimeters around it. This is the danger area, so better to avoid it. And what I can show you is to treat very subcutaneous tissue, very superficial, and I'm treating below the mandibular area. You can see that I'm below and not above, where the point I show you. This is a treatment, typical treatment, but usually we perform a treatment in 1 hour, 40 minutes, 1 hour, and I'm treating the patients in the local anesthesia. You can see that she doesn't complain, nothing. Another point is the mental nerve. It is coming out from the foramen, and this is the mental nerve. But this is a sensory role, but it's another place where we must avoid it. Complication. Well, I had some transient neuropraxia, and you can see, and to avoid damage, we must have incisions planned 1.6 or more, 2 centimeters more below the lower border. So if we have this complication that is transient because we don't have any damage of the nerve, we must give some therapy. Usually, in classification of nerve palsy, we have neuropraxia of the 1st grade in SEDON. So we have a disruption of the nerve conduction, but nerve structure remain intact. So we have a recovery up to 12 weeks. Usually I had in three months, yes. And this is, but we can do diagnosis that is really clinic. We can see that she doesn't move very well on the side damaged. No physiotherapy, but only toxin from the contralateral side in the DAO, the depressor angulus oris or depressor labii inferior, or corticosteroids, and we have many treatment, many protocol of many people. But sometimes I do prophylaxis with vitamin B and alpha lipoic acid before, just to protect the nerve, because usually even if you are not in this side, in this area, you can have a little heating of this area. Now, some before and after, just to show you what we can do with this device. We can have a jawline contouring in this area. When we have a moderate grade, we have a good results, but sometimes we have like this one, a bad outcome of a neck liposuction, and we treat it again. So we have a good results after the liposuction because she had a great empty area. So this is another colleague of Caroline. This is the InMode distributor in Sweden, and she had a good results. this is a neck and jawline. This is a typical jawline of the 50s, and also the neck has a good results. You can see that this area stay far from the dangerous point, have a good result. Even the jawline and the neck, you can see now the depth of the angle. And look at on the right side, you can see after 3 months, but after 6 months is better. Remember, the work, the heating process is going to be better on 6 months and sometimes 8, 9 months. So stop before you see the results, because you will have results in the next month. So this is the shape of a face that is coming from square to round or to triangle face. And I have a contraction. So I think contraction will win the traction, the surgical traction. So we can avoid surgical scar and all the problem that we have in this one. And we can also have the more firmness of the tissue. You can see now this man is bending his neck, and this man has a new angle of cervical angle. We can treat also if they had before a previous surgical story like this one, this woman. So we have our scar. The scar are a good transmission point for the heating. We can create an angle just in some areas, and immediately, this is the timing. This is immediately what we can see after the treatment. After the treatment, we have a great contraction of the skin, but this is not the final result. And this is the timeline. Before, after 1 month, but after 3 months is better. But after I can show you after 6 months and 1 year is going to be better, like this one. This is 1 month. This is a combination technique. This is upper breath, fat grafting, and face tight on the neck, on the jawline. But look at the jawline. Look especially on the jaw. You can see after 4 months is much better. So I think that you can agree with me that this is a facelift case. But if the patient doesn't want a facelift, what we can do? Just this kind of treatment that are really a good treatment and no invasive. This is another case that I want to show you. She had a great weight loss, 22 kilos in the meanwhile after the treatment, and she had always the same results, but not in the body, but in the face was good enough. What about complication of face tight? So infection, I've seen one, this is not my patients, but my colleagues send me, say, oh, I did face tight, but I don't understand what happened. So it's preferable to use antibiotics because this was an infection. So don't think that when I'm treating with heat is not infection. Cannot have infection. We can have. We can have also minor complications like irregularities, like asymmetry, like hardness of tissue, like insufficient results. And we can treat all of them, even thermal nodules. This is an indentation of a treatment of a man. This is a retraction excessive, and this is an excessive overheating. This is a thermal injury, but fortunately they fade away. These are not these are laser lipo because it was really a necrosis about the skin, because you have on the tip of a fiber all your power, and maybe she did too much superficial, and this is monopolar. But it's just to remind you that we don't overheat the tissue, because sometimes they can have a great retraction after a few months. What we cannot treat, we cannot treat great skin laxity. We cannot treat in the area where there are some silicone implants, but if they are on the chin, we can treat the jawline. If they are too much skinny, well, I don't think we have a great results. We cannot treat absolutely pacemaker and defibrillator patients, but they can have an interference with electric. And be careful when they have dental metal implant, because they can have pain on this area. But so be careful, and sometimes we must protect them. Start thermal procedures after good training is really important. Follow guidelines. This is very important. And know anatomy and the dangerous points of treatment is really important for us. Use the proper handpiece, so Acutite, FaceTite, or Morpheus, depends from kind of people. Read the book, read all where I have some articles. This is an article that I published with famous Cheryl Aston and Chris and Aris Dayan, my friends in the US. And where is it? And remember, find the intruder. There is one intruder. Don't use it just in the office, just on the seat, on the chair. But please give some sterile drapes and some sterile, very important manner to treat. So don't use like barbers. We have a lot of, okay, sorry, we have finished time. We have a big, oh my God. Oh, okay. We have training, and we do, and I hope in your area, we will create some training center. This is where I work, and many doctors come to see and to touch and to understand. I can do in 40 minutes everything for you, but just to understand you, that we need something to understand and theoretical after practical area. And this is all my training all over the world where I've been, and maybe we will the next in Australia. I don't know. I hope to find you. Thank you very much for your attention. Hello, George.
Thank you very much, Dr. Rovatti. That was an extremely informative discussion, and you've covered everything so very well. Now, we've got a few questions coming in. So the first question, please, Dr. Rovatti, is your preferred method of pain relief when using the Morpheus 8?
Well, I'm using only local anesthesia, and I don't give any pills, any painkiller after, because they don't have any pain. I use local because many doctors, many colleagues are talking with me about only topical anesthesia. I don't believe in topical. First, because sometimes it's not enough and they don't come for the second treatment. Second, and really important thing is, when I'm introducing liquid in my dermis, just I use 4 millimeters needles, I'm protecting the skin, and I'm also giving a more diffusion. I'm spreading the heating, because, you know, I'm heating also the liquid, and the liquid is spreading there. So I have more results. So I prefer local anesthesia, but usually I use some local just for all the neck. I use 5-10 milliliters of local and saline solution.
And how often would you repeat your Morpheus 8 treatment? At what sort of intervals?
Not less than 2 months. I wait 2 months and after I repeat. And usually depends from the patients. After 2 treatments is enough, or 3 treatments. But after they can do again. So there is not a limit. It's just all the times is better with the skin.
And what about with Acutite and FaceTite? What would you consider a good interval?
Well, Accutite or face tight, I repeat, if I don't have a great results after 1 year, nine months, 1 year, I wait all the process of tightening and all the healing of it. I wait 1 year and I repeat.
Thank you. And if I might just remind all the delegates that if you have a question, please just type it into your chat box at the bottom of your screen. Don't hesitate, just send them along so we can get an opportunity to discuss them. Now, there's a question here. Thank you, Dr. Paolo, for the upper eyelid. How does the Morpheus compare to other non-surgical options like plasma and CO2?
Well, different results, different device, different target. So I used for many years the fractional CO2, and I have a great changing in the skin quality, but nothing in the tightening, because with a fractional RF, I'm going deeper, but I have more diffusion of my heating, so I have tightening of the effect. So this is different. And about plasma, I told you that now I hope they will change the device, the handpiece, sorry, because now it's really big to go in a very careful area like the neck. So for the body, I think is a good idea to use this kind of device. But in the face, I'm really worried about it.
What would be your precautions in treating a neck that has a lot of skin laxity and not much subdermal fat?
Well, this is a great problem. So I think there could be, I didn't show you to everybody the classification because it's very long to show it. But I think that some cases are not good for this kind of device. If we have too much laxity of the skin, if we have too much skin and not enough subcutaneous, forget it and do something else. Do a facelift. I treated, I did many times, but I didn't have any good solution. Remember, our target is fat. If we have subcutaneous fat, if we have 1 centimeter of fat, we can treat it and we can have a great contraction, because I need the fibroreceptor network, and fibroreceptor network is among the fat tissue. So if we have, we can treat. If we don't have, forget it.
And would that also apply with the Morpheus?
Yes, you can do it, but you can have also a changing of quality of the skin, better quality. I can show thousands of pictures about the difference of skin in the quality, but sometimes patients come to you just to have a great contraction of a tissue, because the laxity is the first problem. And you must speak with the patients and you must understand exactly what are the right indication for this device or not.
Another question here regarding alpha lipoic acid and vitamin B prophylaxis. What is the recommended dosing?
Well, usually I use amoxicillin, and I use 1 gram per day, twice a day, sorry. And I give for 5 days, 6 days. That's enough. But usually I start the day before the treatment, and after I will give for the next 5 days, and that's enough. This is good for us. I don't think it's a good idea to avoid antibiotics.
Now, the contraction that you see during a treatment, does that stay, or is it a result of desiccation? And how long do results last?
Well, I have 12 years of experience of this one, but I can tell you that the first cases 10 years ago were not so made from so an expert. But anyway, 5-6 years ago, I started to do different way, because different device, because the Embrace was different. And so we have changed guidelines. We treated in a different way. And now I'm telling you that 5-6 years, the results are still stable, still good. And this is very, very good results, because after 5-6 years, I started to treat again my patients. They come again, because this is good idea. I can treat again. Even if you do a facelift, sometimes the second facelift is more complicated, and sometimes there's really more trouble and more complication. But here, if you let the fat, if you don't remove the fat, because fat is really important, if you don't remove it and you can only treat, contract, tight this fat, it's okay. After it shrink, and after it will change again and will lose again, and after you can treat again. Sorry for my English, but
It's actually very good, very clear. Could you just describe the safe approach, your approach, when treating the gel area to avoid damage to the marginal branch?
well, I tell you, I usually in the marking, I always, still now, after 10 years, 12 years, I mark the area, the dangerous area, so I can remember where I don't want to have, don't want to go and to treat. But I tell you, in this year, I've seen some of marginal mandibular injury, fortunately, always temporary. And all the times was because there was not so much fat, and maybe I was deeper. This is my idea. So when we did a consensus, a great consensus in North America, I was in Canada, and with my friend Steve Mulholland, we did with 10, 12 plastic surgeons a consensus, and they appreciated my approach on the lower mandibular in this area, in this point, to enter and to treat the jaw in this area. Because with my handpiece, I go far from the area, the danger area. If I have a sublobular entry point and I go, maybe sometimes I can reach the area, because sometimes I forget, sometimes I'm just looking something else, and I'm not thinking that here maybe I can hit this area. So I prefer this point, and they call it, just laughing at me, they call air point, this point of Rovatti, because I introduce this area. And this is an idea, it's just up to you. If you want to can enter from this area and you can treat here, okay, that's good. But sometimes I can enter from this entry point, 2 centimeters below the mandibular border, and I can treat all this area of the neck, and even here, I can cross the jaw, the border of the mandible, the bone, and I can treat this area. This is my suggestion. So sometimes I can tell you, it happened also in one patient that I didn't treat this area, and I treated only the neck, but maybe the garment compression after a few days, because usually after for 3-4 days, I give the compression garment 24 hours a day. And sometimes the compression make spread the infusion, the liquid, the anesthesia, just hot in this area. And this could be a little damage. And usually I've seen after 1 month fade away, but it was just for the liquid maybe. But is a good compression because it's good for the final results, so we must do it. Sometimes I can put some ice cold here and to stop the liquid to be very hot.
Thank you very much for that. Do you have any advice for managing blisters or epidermal damage following Morpheus 8? How would you manage that?
Well, I've shown these patients that I have. Just she was worried about the treatment, and she moved, and so I had the tip of my Morpheus was not on the skin, so she had the burn. But I show you only one case that I had. I didn't have any problem about Morpheus because Morpheus is very safe. And so my advice is to avoid too much energy if you use Accutite and Morpheus for the 2 layers. Because if you are treating the subcutaneous tissue and you are treating also the dermis and hypodermis, well, don't use too much energy, because 1 and 1 is 2, and sometimes it's 3. This is. But I can tell you, when we have some little burns, we can have antibiotic topical, and that's enough. It's okay. I had very, very few hyperpigmentation on it.
Can you use Morpheus or Accutite to treat skin contraction, tethering, scarring from VASER after, say, liposuction on the arms, for example?
Well, I tried only 2 times VASER. I can tell you that the difference among VASER and this device is the contraction. I have more tightening on the bipolar RF, but anyway, VASER is a good technology for the body. What I can tell you is that I'm doing now on the body with a body tight cannula that is really bigger than this one. I can treat just before the using the liposuction. If you do liposuction before, maybe you can destroy septa. And so after you can have a tightening that is not uniform and not for vertical or horizontal tightening. So that's why I prefer to use now, after many years that I did before liposuction and after tightening. Now I'm doing first tightening and after liposuction. With VASER, you can destroy the septa. And this is why I don't think it's a good idea to make tightening after VASER. But many colleagues did it, and they told me that they had good results anyway. I can tell you my experience, because my experience is not with VASER, but only with liposuction and body tight.
Can you combine the Morpheus with thulium laser for sublative skin resurfacing?
Yes, absolutely. This is not ablative tissue, but I prefer to use in 2 different sessions. I don't want to heat too much the skin, because anyway, even if we are treating 3 millimeters, 4 millimeters, and this is not a needle, ablative needle, because it's insulated anyway. So it's the same story. Skin, dermis, subcutaneous, too much energy. Well, be careful with the patients. So I combine. Yes, I did many times, but not in the same session.
What is the average duration of treatment when you're treating the neck and also the lower eyelid?
Well, the time you mean? Well, usually when I'm doing lower lid, I lose 5 minutes, not more. And the neck is more longer. And usually on the neck, I spend 40 minutes, 40 minutes on the neck, because I combine Accutite and Morpheus, only light treatment of Morpheus the first time. The second time I do only Morpheus, and usually I have a more effort, more good results.
There's a question here, if you could just explain once more the centimeters, the safety zone of the marginal mandibular branch.
Yes. Usually, in many papers, it's published that is 3 centimeters above the masseteric tuberosity. So you can palpate it and you can find it. But sometimes some people speak about in the middle, from the medial chin line to the masseteric tuberosity. Anyway, remember, where you have the fascial artery, here is the line where you can cross, you can have the cross of the nerve. And so you can have a point 2 centimeters below the commissure line. And in this area, you can have a circle around 2 centimeters. So in this area where you have a commissure fold, in this area, forget it, don't go it. And usually I do a line 2 centimeters lateral of the commissure line, and I say, okay, not more than here. And when I treat this area, I treat and I stop here. If I go from this entry point, I go up. If I go from sublobular point, I stop. And it's very important to mark your line. Stop and mark, and so you remind, and you all the times you see where you are going, because you have the electrode, the external electrode is just where is the internal electrode, so you can see where you are. And remember, stay superficial. Remember to stay on the subcutaneous fat only. If you find the platysma muscles and you go below, you find the nerve. It's not a problem for the muscle, it's a problem by the nerve.
Now, just coming back to the tethering or scarring from VASA lipo, the doctor posed the question, would like to know if you can treat the actual scars or the actual tethering fibrosis with the Morpheus or the Accutite. Can you treat the actual problem, the complication?
Well, when you have some scar, when internal scar, I mean, you can treat with the Accutite, with FaceTite, and so we can have also a great contraction, because they work, the scar works like the septa. So you can have a great contraction even if we had a previous scar lift or something like this. With a Morpheus, you are only in the first dermis layers. So you are going until 4 millimeters. Sometimes you don't find any scar, but you can treat the skin and not the scar. The scar you are treating with the handpiece like Accutite or FaceTite, because the scar are on the subcutaneous fat.
What with the treatment of fat pads in the lower eyelids, you mentioned using Morpheus 8, the deeper penetration with the body. Could you please elaborate on that? I know you said that you've only done a few of those and still in trial.
It's still a trial. I'm trying to show the results and to understand if it's really good. So I don't think to have any problem with nerve, because even in 5 millimeters, I will not find any kind of nerve or fascial nerve in this area. But the same way, when I go to the mother bag, I go with the Accutite, I'm going to the SUF. So what's my new way is just to avoid the swelling. People are always complaining about swelling, because with the Accutite, you have 15 days, 20 days, 3 weeks with swelling. And so the patients complain about this. So with Morpheus, you don't have any kind of swelling, and this is good. Maybe I deliver the less energy, but in 2-3 times I can have maybe the same results. But I still try. I give you just only this case, just like a trial. I will tell you much better if when I will have results, at least for 10 people, and I'm doing. If you don't experiment, if you don't try, you cannot have a different results or different techniques.
Now, there's a question here regarding the area near the mouth corner where a nerve passes through. Can you repeat the 2 centimeters left and 2 centimeters up?
Well, I can show you the photos. This is better, and maybe they can make picture about this one. If I can show you, wait. Okay, it's not here. Okay. This is the area, the masseteric tuberosity, 3 centimeters from masseteric. There is the emerge the nerve, and marginal mandibular nerve is crossing the fascial artery. So that's is it. And oh, I want to show you, where is it? Where is it? Oh, wait. Sorry, just a minute to understand where is it. No. Okay, it's here. I think everybody can make photos. This is more or less. So we have 2 centimeters posterior to the commissure, oral commissure. And we have in the middle of the mandibular body, and we have a radius of 2 centimeters around. This is the worst dangerous area. But usually when I'm treating, I make a marking more lateral, and I say, okay, not more than here. But remember, if you are treating the subcutaneous tissue and you have your heating device just among the 2 electrodes, you cannot have any problem. I did hundreds of this procedure, and I had only few marginal injury, like 5, 6. But we are speaking about 500 treated people, so it's very low. But anyway, it's always waiting for you.
And what if somebody has quite a thick jowl pad? How would you manage that? Is that still purely subdermal?
Well, always subdermal and always lateral, because you have a contraction. And if you treat only this area, maybe you have a contraction of this area. I can show you some picture about, I don't have here, some patient that had a big jowl, but I've treated only lateral, but they had a contraction, so you cannot have to reduce it with a lot of energy. Let me see if I have something here. I had one patient that I didn't show you. but maybe I can show you what you can have. Maybe is here. No, I don't have any here. No, sorry, I don't have, but it's just to show you how is the contraction, but I can find it. Wait. No, it's not here. If you have just few minutes, if you want to tell me some different questions, I can answer, but I can find something different.
Yes. With the malar bags, is your preferred treatment with Morpheus or Accutite?
Well, malar bags usually needs two treatment, 2 layers, because it's very deep, it's invasive. But sometimes you have festoon and you have also a little losing and sagging skin. So I prefer the 2 treatment. But if I can choose someone, I tell you, I prefer Morpheus, because I can go deeper and I have less swelling, and swelling, you know, the malar bag sometimes is edema, is swelling. So I don't want to have anymore. I had a good results. I didn't present you, I didn't show you, in a patient that had a big swelling for 1 year, because she did from one colleague, hyaluronic acid in this area. And you know, is a hydrophilic, hyaluronic cools waters. So she had swelling for 1 year. And with Morpheus, I did a good job, because I treated this area and I dissolved the liquid, the edema, with only Morpheus. I can show you even this one, but they must find it. But now I'm preferring in the last 1 year, 2 years, I'm preferring Morpheus for some things. Yeah, well, not for everything, but for some things is less invasive and same effective. Let me see if I can find. Well, I think that if we compare to some other treatment, we have less complication of this treatment. So what about Kybella? What about desoxycholic acid? So I saw many complications. And so now, I don't know where in Australia, but in Italy, now it's forbidden, the use of it on the neck, because they create a lot of problem, even a nerve problem. And what about only liposuction? Well, I don't think it's a good idea, because you have a losing skin and you cannot contract and you cannot tighten them. What about Vaser? Well, I think it's too big for this one, and I don't have great contraction like this one. What about plasma? Well, I think they will change the handpiece, because now they are still big and still big for neck. Now, in this moment, I think this is the great option, the greatest option.
Thank you very much, Dr. Rovatti. Now, just one last question, and we've gone over time. I do apologize. One question about Vaser. How long after you've done the body tight would you contemplate doing a Vaser?
Sorry, I don't understand what you mean.
The question regarding body tight. You do first the body tight, and then how many weeks after can you perform Vaser liposuction?
Well, usually I must wait when I do a next surgery. I need 6 months, minimum 6 months, because the process of heating and contraction is very long. So we must start again treatment when everything is completely finished.
Thank you very much. Dr. Rovatti, Your talk has been excellent, and we've all learned a lot of interesting questions, and we have gone over time, so I do apologize. I'd like, on behalf of all of us, myself, InMode, and all our delegates, to thank you very much for giving us your time and your knowledge.
Thank you so much. Hope you enjoyed the webinar. Ciao.
Ciao.